Okay, thank you everyone for joining us. We're going to go ahead and get started and we might have some more folks trickle in. So thank you for joining us for today's webinar. My name is Wagata Sumare. I am the director of the Champion Provider Fellowship and very happy to have you all with us and excited to be able to introduce our speakers. If you're having any trouble with your audio, just send us a message and let us know. We'll first start out with our land acknowledgement. We would like to acknowledge the Ramapough Ohlone people who are the traditional custodians of this land. We pay our respects to the Ramapough Ohlone elders, past, present, and future, who call this place the land that UCSF sits upon their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramapough Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding.
I'll take this slide, some housekeeping. We'll keep everyone muted through the course of this presentation. If you have any questions or general comments, please use the chat box and message me. For best viewing, we recommend using your computer audio and maximizing your Zoom screen. This webinar is being recorded and will be posted on our website. And if you're having any technical difficulties, you can message me in the chat. Wanted to go over some upcoming events. Next week, we have our media training for fellows. It is an all-day event and registration is closed. And our next webinar on October 16th will be a presentation by UCANR. It will provide an overview of UCANR and opportunities for future partnerships to enhance community well-being through interdisciplinary collaboration. And we will also be hosting a works in progress call for both fellows and LHDs on November 18th.
Thank you. So I'm pleased to introduce today's presenters. Trina Robertson is a registered dietitian nutritionist who brings over 25 years of experience in nutrition to her role as Director of Health Sector and Program Evaluation at Dairy Council of California. She leads strategic partnerships to educate health professionals on the role of dairy in a balanced diet and oversees program evaluation to measure effectiveness. Trina has co-developed widely used nutrition resources, including the California Department of Public Health approved Every Sip Counts tip sheet with Orange County Healthcare Agency. Crystal Mylander is a registered dietitian nutritionist and the Nutrition and Scientific Affairs Director at Dairy Council of California, providing thought leadership, direction, and oversight of processes to ensure scientific integrity throughout the broad range of Dairy Council of California's nutrition education programs. She has held various leadership positions with the California Academy of Nutrition and Dietetics, including the Vice President of Communications. She earned a master's in public health from the University of California, Davis, and a BS in nutrition from California Polytechnic State Institute, San Luis Obispo. She completed her dietetic internship at Tulane University. Thank you both for being here. Looking forward to this presentation. Following the presentation, we'll save some time for discussion and Q&A.
Thank you very much, Wagata. I appreciate that introduction. I'm Trina Robertson, and I'll do the beginning and then the close for this presentation, and Crystal will do the midpoint of it on the dairy matrix and the impact of dairy foods on health. So thank you, Nancy, for advancing the slides. The next one really just talks a little bit about Dairy Council of California. We are a nutrition organization, and we work to elevate the health of children and communities by fostering lifelong healthy eating patterns through education, which is the most that we'll talk about here today, with some on advocacy, and we'll end on ways that we can collaborate with you. We are funded by the dairy farmers and processors in the state, and we have oversight by the California Department of Food and Ag. On the next slide, we have the learning objectives, and you can see really where we're putting our focus is on how there's been the evolution from nutrient-based approach to a food-based dietary guidance system. And then we will talk about the food matrix, using the dairy matrix as an example of an effective way to deliver nutrients. Third, we'll talk about the impacts of dairy foods on health outcomes. And finally, we'll talk about the food matrix concept and how it can be used in public health applications. And with that, I'll turn it over to Crystal.
Hi, thank you, Trina. Yeah, so before we can get into talking about healthy eating patterns and recommendations, I just want to touch really quick that say it's important to understand that most Americans across all age groups have poor quality diets, underconsume recommended food groups, specifically fruits, vegetables, whole grains, and dairy, and ultimately experience nutrient shortfalls that are of public health concern. So those are calcium, potassium, vitamin D, and fiber. And so when we look broadly at Americans' consumption patterns as they align to the recommendations, we know that there's a lot of work to be done and there's opportunities for improvement. The next slide. So really briefly, just looking at how we got here with the dietary guidelines for Americans, they've really shifted a lot since they were first released back in the 1980s. And each edition has reflected new science, changing public health priorities, and evolving nutrition debates. So back in the 1980s, we can see when it was first introduced, weight control was really the prominent focus. Then in the 1990s, we know the food pyramid was introduced, and there was a strong focus on reducing dietary fat and cholesterol. And in the 2000s, we started to see that shift away from that purely low-fat focus towards balance and variety. And then in the 2010s, there was that major shift where we're seeing more of a focus on overall healthy eating patterns rather than those single nutrients. And then most recently, in the 2020s, this was the first time the recommendations included guidance across the lifespan from infants to older adults, and it really reinforced flexibility by recognizing cultural foodways and personal preferences. Next. So this just illustrates how, diets have shifted over the decades from that focus on calories and sufficiency of nutrients or food groups compared with the requirements to now we have this more focus on a balanced, diverse selection of nutrient-dense foods eaten over a period of time. So the 2020 Dietary Guidelines for Americans really capture this well, and they have a statement in there that states, researchers, public health experts, and registered dietitians have all acknowledged that nutrients in foods are not consumed in isolation. Rather, people consume them in various combinations over time, a dietary pattern, and these foods and beverages act synergistically to affect health. So although essential nutrients are the most commonly recognized food components that impact health, even these are dependent on the food matrix in which they are delivered and have been shown to behave differently depending on how the greater food matrix structure. So just to give a brief example, research has shown that calcium supplementation may increase coronary artery disease, while calcium from foods does not. So this indicates that when certain nutrients are consumed within the context of a food matrix, they may offer more protection against disease than when they're not. The next. Let's see. So this introduces that emerging concept of the food matrix. So USDA does have a definition, and they define it as the nutrient and non-nutrient components of foods and their molecular relationships. So essentially, food is more than the sum of its nutrients. From a nutrition standpoint, we know that foods are comprised of macronutrients and micronutrients, but it's much more complex than that. Whole foods have unique food matrices consisting of a dynamic network of both nutritional and non-nutritional components, as well as their physical structure. So that means whether it's liquid, gel, solid, semi-solid, frozen, cut, or chopped, etc., making them really unlike any other food. Next. So the dairy matrix is the composition of nutrients, bioactives, and other compounds that are present in milk and other dairy products, as well as their structure and how they impact digestion, absorption, and physiological functions. So this concept can help explain why the health benefits associated with dairy foods consumption include and can go well beyond each dairy food's individual nutrient profile to its matrix and its relationship between its non-nutrient and nutrient components. The matrix of milk, as you can see on the slide, is composed of a unique proteins, carbohydrates, fats, as well as those essential nutrients. And this combination of its components and its liquid form can all impact its physiological functions and health benefits when it's consumed. Next. So what's even more interesting is that when the physical milk matrix is transformed by fermentation, heat, and other ripening processes, like when cheese and yogurt are created. So these foods also have their own unique nutritional and physical matrices and contain bacteria with the potential to produce additional bioactive compounds such as peptides and short-chain fatty acids. Next. And just to briefly touch on bioactives, these are defined as constituents in foods other than those that meet basic nutritional needs, that are also responsible for changes in human health. So this may contribute to the differences we see when we're looking at whole foods versus just those individual nutrients and their impacts. So this is, the lesser known components of milk and other dairy products. And they continue to be subject of investigation for many years now, sorry. And their potential bioactive components within proteins, fats, and carbohydrates that are really being studied for their distinct effects on their health promoting benefits. So this unique matrix within each dairy food and the interactions therein help explain why dairy foods are associated with positive health outcomes, like the reduction of risks for chronic diseases such as cardiovascular disease, type 2 diabetes, and hypertension. What's being explored even further is dairy foods' association with functional health benefits. So a functional health benefit is the positive impact a food has on health beyond the energy and nutrients it provides. Some examples out here on the slide of functional health benefits that are being looked at as associated with dairy foods include inflammation. So research has shown that dairy foods have a neutral to beneficial impacts on chronic inflammation. Cognition, dairy provides nutrients like protein, B12, iodine, and choline, which are all essential for brain development during early childhood. Sleep, dairy foods may contribute to better sleep by providing tryptophan, magnesium, and zinc, which are all essential for serotonin and melatonin production. Furthermore, fermented dairy foods have also been linked to better sleep by contributing to improvements in the gut microbiome. Immunity, so 6 of milk's 13 essential nutrients, protein, vitamin A, D, zinc, selenium, and B12 all work together to contribute to a healthy immune function. And then finally, disease prevention. So when consumed as a part of a healthy diet, dairy foods have been associated with lower risk of overweight and obesity, as well as, like I mentioned earlier, that reduced risk of cardiovascular disease, type 2 diabetes, and stroke. So just really quickly, this is a nice visual that shows an example of that. This is based on a recent scoping review of studies which found that dairy consumption, both total and individual dairy foods, may moderately reduce the risk of several health outcomes, including adverse cardiovascular outcomes and certain cancers. Next. And then specifically using yogurt as an example, in 2024, the U.S. Food and Drug Administration announced its first ever qualified health claim for yogurt. So the claim identifies a potential link between yogurt consumption and reduced risk of type 2 diabetes. So this claim can be made for all dairy yogurts that meet FDA's standard of identity. And the scientific evidence supported that association between yogurt as a food rather than any single nutrient or compound and its reduced risk of type 2 diabetes, and is independent of the yogurt's fat or sugar content. So this just confirms that research that shows that yogurt has a unique food matrix, which may play a role in its protective effects on diabetes, regardless of its fat content. Okay, and so now I'll turn it back over to Trina, who will discuss how this concept can be applied to support overall healthy eating.
Perfect. Thank you so much, Crystal. So really what you see on the screen here is just the stages of life and how dairy can be supportive. And I'll pick a couple just to share. So starting at preconception, the first 1,000 days, which is from conception to age 2, there's important nutrients for growth and development, particularly cognitive. So, the normal nutrients you may think of during pregnancy: calcium, vitamin D, iron. Also, iodine and choline are very important for brain health. And N. Haynes review indicates that a good number of pregnant women in the United States are iodine insufficient. And you may say, oh, well, we get iodine from salt. And that can be true if you buy iodized salt. But most people now are trying specialty sea salt, Himalayan, kosher, and even fast food that has salt added. Most of these do not have iodine added. And even prenatal supplements usually only have a very small amount of iodine. So dairy, particularly milk, is a good source. Early childhood and adolescence, a JAMA article that just came out this summer indicated that over the past 17 years, kids' health continues to decline compared to other first world countries. And so this is really a critical period for optimizing nutrient intake, but we have those nutrient shortfalls for those 4 nutrients that Crystal mentioned in the beginning: calcium, vitamin D, potassium, all of which are in milk, in dairy, along with fiber. And so, this is a period where they have a lot of bone growth that they can optimize. So having healthy eating patterns are important. And then we have adulthood and older adults. And in older adults, their nutrient needs tend to drop. And it's even more important that they have high quality protein to maintain muscle mass and to help reduce the risk of falls. And also, fermented dairy foods can help with a diverse microbiome. And there's even a little bit of support for cognition. On the next slide, it shows really how does dairy fit within cultural foodways around the globe. So healthy eating really embraces an individual's preferences, their culture, their traditions, and their budget. And so here you see a number of dairy foods, many of them that are fermented with live active cultures that can benefit digestive health for a healthier microbiome. And then some people may have a food allergy or lactose intolerance, as shown on the next slide. And for a dairy allergy, that would usually require no dairy and instead using fortified soy beverages. But for lactose intolerance, which is the inability to break apart that milk sugar, choosing lactose-free milk is an excellent option. And then some people do very well with yogurt, with the live cultures or cheeses. And also just pairing dairy in small amounts with other foods can be another strategy. The next slide shows you the chart that takes foods that are dairy foods that are low or no lactose, like a lactate milk or natural cheeses, all the way up to those that have more lactose in them. And so finding the ones that work for people based on the foods that they enjoy is what the recommendation is. And even the National Medical Association updated consensus statement on lactose intolerance and health disparities recommends trying to find ways to include dairy and then opting for lactose-free dairy options as needed. And then the recommended eating patterns do include Dairy Mediterranean Diet and DASH. Both show how dairy can add nutrients and flavor in plant-forward diets, working synergistically with fruits, vegetables, and whole grains, providing those proteins, calcium, and vitamin D through the dairy matrix. So looking for some specific strategies, there was a recent report that looked at dairy over the past 20 years and found that Americans have continued to drop their intake of milk. And so on the next slide, we have some tips for adding dairy to add an additional serving or 2 each day. And so you can see that there's a variety of strategies. And really that N. Haynes data that was looking at that drop in milk consumption also found at the same time that osteoporosis increased and fractures of the hip, wrist, and spine were more frequently reported. So in summary, Nutrition science is pretty young and it continues to evolve. And, foods are more than the sum of their nutrients, as you can see, with the health benefits of individual nutrients going beyond just those specific nutrients. It's really that combination of nutrients and bioactive factors, and how they interact with each other in the dairy matrix to produce that overall health effect. So now we're going to transition to really talk about, we've gone deep into education. Let's talk a little bit about opportunities for advocacy and then also collaboration. And so I'm going to give one specific example to start with, and that is Dairy Council launched our Let's Eat Healthy initiative in 2020. And right after that, we convened a group of health professionals in the state through the Well-Nourished Brighter Futures. And that convening report had a series of strategies and recommendations to elevate healthy eating. And one of them was around the first 1,000 days. And we were lucky enough to partner with academia and a pediatrician at UC Irvine to get an NIH grant to do a needs assessment in the first 1,000 days. And that led to us receiving 2 grants from the National Association of County and City Health Officials with CDC funding to take the most recent dietary guidelines that looked at complementary feeding between 6 months and 2 years old, and to develop 2 handouts that were culturally relevant, one for African, Black, and Caribbean communities, and the second one for Hispanic families. And so that was a really rewarding project for us to work on. On the next slide, I'm going to share some more specific examples of things we've done. And then at the end, we have a survey. And with that, we have some of these different options. So if you're interested in collaborating with us, you can select one of those areas that you'd like to have us get in touch with you about. So on the far left, we have conference presentations. And this is actually a distant shot here of a former fellow graduate, Dr. Candace Taylor-Lucas, who presented at the American Academy of Pediatrics conference on our first 1,000 days work. Also, we publish journal articles, and so that's another area. And then finally, we work with professional associations. We're working with AAP Chapter 1 in California, the California Physician Assistants Group. We're working with California Dietetic Association. We were at the National Hispanic Medical Association conference this last June. So a variety of different ways to provide that education. We also do advocacy support by translating the research for public health and nutrition policies so that others can be advocates by perhaps submitting public comments. So right now we're really staying abreast of all of the state and federal policies and guidelines and the impacts that it will have on nutrition programs. And we can provide this information back to the champion providers and local health departments for education. On the next slide, we have a couple examples of our policy system and environmental nutrition support. I know that you all work with the school wellness policies, and here in California, Dairy Council and the California Department of Education are the 2 backbone organizations for the statewide collaborative. And so if you're interested, we can connect you with them if you would like to do more work in improving school meals, which is a big focus here in the state. In the lower right corner, it shows you the PSE approach that we had come up with as part of our first 1,000 days work in the manuscript that we had published. And so really thinking about how we can have that wrap around support to have more accessibility to nutrition services and resources. On the next slide, we highlighted some of the communications work that we've done. And so at the top of the screen, we have Dr. Clarice Classelong, a pediatrician in Orange County, who put out a statement for National Milk Day. And then on the lower left, we have Dr. Kristen Rosen, who's a Northern California pediatrician, who shared a reel on social media about the value of school meals. And then in the center, as mentioned before, is the Make Every Sip Count tip sheet. And this was developed with Orange County Healthcare Agency, has been used by their oral health group, and was approved by the California Department of Public Health and has the CalFresh Healthy Living logo on it. This piece, we think, has been reproduced and shared probably about 1 million times over the last 10 years with the different variations that we've had. It is in English, Spanish, and in Vietnamese. So really, we think that the best way to do things is through collaboration, and we are very open to working with all of you. The work that we've done with UC Irvine was recognized by the Let's Eat Healthy Leadership Award last year, and we're really proud of the outcomes we had there. On the next slide, we're showing some of the nutrition resources that Dairy Council has. Everything we have is at no charge. You can either download digital copies or you can request us to mail them to you. Everything is in English and Spanish, and again, you do not pay for these. So on the far left, we have our African, Black, and Caribbean resource for parents who are introducing foods to infants and toddlers. And you can see this has the UCI School of Medicine logo on it. We were able to work with their medical students, which was a novel approach to help them learn about nutrition while they were helping with the creation of this and the social media. We also have the Hispanic version, and we're actively looking to do a review as a new resource for the usability of this in medical centers. So if any clinics are interested, we're more than happy to partner with you. On the far right side, we have our pregnancy booklet, and this is one that we would like to update because we have had it out for a while. So again, you can order this and use this, and if you'd like to give us input or to co-develop, we are more than happy to work with you on it. In the center, we have 2 of our publications. First is our annual trends, which we send out every year. And we do a webinar on this. Again, it's education, and organizations do use this to help drive their strategic planning around the big trends. So this will come out in January. We also have our Healthy Table publication. This last year in June, we published this on healthy aging. This also comes with a handout on aging. So the trends in the healthy eating table, you can use these for education. We also welcome your input as part of an advisory panel to review these resources. So these are some other areas that we can work with you. The last opportunity to collaborate is coming up. We are having Nuestros Sabores, Our Flavors, which is a culinary medicine symposium. This will be held at UC Davis on October 28th and 29th. It's a 1.5-day session. And our national partners agreed that we could open up a few spots to people that are members of this group. So if anyone is interested, please let us know and we can get you more information. There's about 60 people from around the nation that will be attending this. Medical providers, from doctors, dietitians, physicians assistants, and nurses. And so with that, we'll close out with any questions that you may have. And Crystal's going to put in the chat a link to the survey where you could just share what you learned and just let us know of different ways that you might be interested in collaborating. And then I'll turn it back to you, Nancy and Wagata, to lead the Q&A.
Thank you so much, Trina and Crystal, for a really wonderful presentation, and especially for sharing so many resources that are free and available to everyone, and also opportunities to engage with you all. I think really some great opportunities. So we have time to take some questions. You can put them in the chat, or we can have you unmute and ask your question directly. One question while folks are gathering some thoughts that comes to mind is you guys have done quite a bit of work in developing these resources and needs assessments. Just curious if you've had opportunities to look at what's happening locally with engaging with these resources in terms of evaluation on the other end, and how that sort of iterative process has worked with engaging with the advisory council or like actual, constituents and community members to kind of continue to reiterate what you provide.
Yeah. Great question. So leading the evaluation, we do evaluations of our programs that are in schools and with health professionals. It's always easier for us in schools because you have a full classroom. When you get into the clinics, it gets a little bit more challenging. We're actually working right now in Orange County to try and get into some FQHCs to do a review of those first 1,000 days handouts. And that one's just going to be on usability. We have done testing with some of our other ones that are more broad to look at what providers think and to see what the end user, the adult, thinks of the booklet, and then we make updates. Something else that we do for our new handouts, for example, the one on older adults, we first go to the health professionals and have them go through and do just a usability of what they like, give us revisions. And so we're currently on our second round of that. And then once we feel like it's in the best place, we'll ask for assistance in getting end user feedback as well. That's usually done through surveying to see, what changes people have in knowledge, attitudes, and ideally in their behaviors.
Really helpful. And just a brief follow-up, are there opportunities for fellows, any of our clinicians to engage on that evaluation piece? Is that something that would be helpful?
100%. We would love to be able to have support with doing those evaluations and yeah, in the survey, or they can just reach out to us. We'd be happy to get their input. And we're also, as I mentioned, working with the medical students. We think it's great if the providers want to do it. We also think this is a way to educate those future health professionals for them to be able to learn more about nutrition by going through the process. And so, again, we're looking at the UCI medical students and doing a training with them about nutrition so that when they interact with parents, they have a little bit more of that basic knowledge. So there's ways that we could work with current professionals and those future professionals as well.
That's wonderful. And have you guys, in that, I'm thinking of the UC Irvine example that you shared, and really sounds like a great example of a partnership with academia. And just curious if in that process you guys were sort of, you guys approached UC Irvine? Did you start from the beginning in terms of like presenting the grand idea, or did that just sort of come out of, discussions and the work that you wanted to do? And yeah.
So that started, I was a member of their, oh my gosh, ICTS, so the Clinical and Translational Research Center. And so they had a call for the grant. And I worked with the dietitian researcher who worked with the School of Medicine. And that's how we worked with the pediatrician on staff. We also have opportunities to work with health professionals that we've met through conferences, for example. So we were at the AAP Las Vegas event that they have at the end of every year. And that's how we connected with a pediatrician. So, and then we also reach out to some based on those who express interest to Dairy Council through our annual engagement survey. And they say that they'd like to help with providing feedback.
Wonderful. That's really, really helpful to be aware of. And it sounds like the best way to engage with you guys. And that culinary event sounded wonderful. So if we have anyone interested in that, is to just reach out to you directly.
Yeah, or they could reach out to you all and you could forward it to us, whatever's easier for everyone.
Okay, that sounds great. And I guess any sort of key tips that you have in terms of low sort of hanging fruit in terms of ways that you think some of the fellows can engage if they're just sort of starting out at the community level, want to kind of provide more system level education and engagement in the community? What are some thoughts you have about how they can sort of start to approach that process?
Yeah. Well, I mean, I know that you work with the local health departments and they often have really great campaigns. And so being able to support the community at events, doing exhibits is a great thing. I know that there are some that have used our resources to complement what the local health department has to be able to do that education. I think that's always a way. We have our newsletter that has information, and so that could be forwarded for the information that they think is most relevant to their audience as well. Crystal, do you have anything else to add?
Yeah, I would just say, I mean, from my own experience too, it's what you always hear, it's the networking. So I know Like when I was getting involved with different groups in the community, you'll find, within cities or counties, there are groups that get together, like nonprofits and collaboratives. So maybe finding those who are getting involved in the community and just making those connections.
Sounds really great. I guess one of the final questions I have that comes to mind is just thinking about, you've had engagement with pediatricians, anything you can speak to with dentists or future thoughts on engagement or prior experiences that have been helpful for you guys.
Yeah. I know, like with the oral health handout, that was or the Rethink Your Drink handout, Make Every Sip Count, that was our first opportunity to really work with dentists, and we really appreciated their input and to see how they could support nutrition in their practices. And then with the first 1,000 days, I remember there was one dentist in particular who talked about the importance of oral health and sharing those nutrition concepts with families at a very young age. So yeah, I think there's a lot of opportunity for dentists to be able to participate as well. And like you mentioned, we're having that symposium and we'll have about up to 60 people there. I think that'll be an incredible networking opportunity. So if anyone is interested, I think that'll be a good way to see how others are going out into their specific communities.
Yeah, absolutely. Thank you for making that available to this group. It sounds like a wonderful opportunity to get plugged in. And yeah, we've had fellows doing kind of work across the spectrum. And I think there are many ways that it aligns with the priority areas that you outlined, and really looking forward to helping plug in folks to those opportunities.
I think one other thing, we're really excited about is this trend for food is medicine, and really talking about how can we improve everyone's health through preventative measures like making healthy food choices. And so this culinary medicine is really a way to activate that and talk about, well, what can we do to make the healthy choice the easy choice? How is it that we can make food more attainable, that we can talk about foods that are relevant culturally and that really fit people's diets and the amount of time they have to be able to cook? So that symposium, and we see work that we're going to be doing after this, is really going to be addressing how do we help people to move to those, whole food choices in ways that feel easy to implement.
Absolutely. That's really wonderful to hear. So I will, if we have any other questions that are coming through, but if not, if there's anything that we didn't cover, any final words. Oh, I think we might have, Abby, were you unmuting?
Yes, yes.
Oh, go ahead. Go ahead. If
Yeah,
you want to briefly introduce yourself too, that'd be great.
yes. Myself, Dr. Tucker. I'm the dentist working in Camarena Health. It's an FQHC in Madera County, and I also work as a director here. And I am a part of this cohort with UCSF Champion Provider Fellowship. So first of all, thank you so much for a great presentation. I just wanted to add that I was just reviewing your website and everything. So yeah, anytime you guys need any dentist input for anything like this, like reviewers or everything, I'm more than happy to jump in and help you. And I also put it down in my survey as well.
Thank you very much. We appreciate that.
Absolutely.
Great. Thank you, Abby. And we will be, sure to share that survey out with those who weren't able to attend, might be listening to the recording later. I think a lot of people would be interested in participating.
Absolutely.
Yeah. And I guess as we're seeing if there are any final questions, happy to kind of give it back to you guys if there's any final comments or things that you wanted to make sure that we pass on to this group.
I guess we are here in the state, and we, are very passionate about nutrition and helping. So please feel free to reach out to us at any time. And we really thank you for this opportunity to be able to share this information with you. And we'll be following it closely with everything, as I mentioned, that's happening at the state and federal level.
Mm-hmm.
Yeah, absolutely. Really timely and nice to have sort of an optimistic look at opportunities to keep advocating for this important work. So thank you for taking the time um, to prepare this webinar, speak to our group, and for all of the opportunities. Looking forward to maintaining this partnership.
Likewise, thank you.
Yeah, thank you.
Thank you.
Thank you, everyone. We will post a recording of this webinar within a few weeks or a little bit longer, pending some ongoing updates to our website. But look out for that and feel free to connect with us if you have any questions. We can connect you to Trina and Crystal as well. Thank you, everyone.